I know that some people like to know the why behind things because that helps them actually do those things. So let's talk about why exercise is good for your thyroid. And then I'll talk about how to exercise so you can actually obtain those benefits. If the benefits I'm about to discuss aren't enough to motivate you to exercise, I don't think anything will help. Exercise is probably one of the best treatments you can do for your thyroid. But more often than not, most thyroid patients ignore it. First, we have higher levels of free thyroid hormone, which is very important for thyroid patients. If you think about it like this, why are you taking medication to raise your thyroid hormone levels? You can get these benefits for free by exercising instead of taking prescription drugs. Your thyroid will work better, and you will have more control over your symptoms if your free thyroid hormone levels are higher. I am aware that weariness can make exercise difficult for thyroid patients, but ironically, exercise can improve thyroid function, which in turn can boost your energy levels. This is just another way of saying that exercise improves thyroid function, and it's huge because it means that you have another treatment that can improve your thyroid that doesn't require a prescription medication from your doctor. Research shows that exercise not only benefits your free T3 and free T4 levels, but also your TSH level. Therefore, it makes perfect sense that if exercise were to increase your free thyroid hormone levels, you would also see a decline in your TSH. Normally, if you wanted to lower your TSH, you would have to increase your thyroid hormone medication. However, in this instance, lowering your TSH can be accomplished without changing the dosage of your thyroid medication. Losing weight is the third advantage. Exercise may help thyroid patients lose weight by regulating hormones, including thyroid hormone, by boosting lean muscle mass and metabolism. If enhancing thyroid function wasn't enough to motivate you to exercise, then this could be the advantage of weight loss. Exercise has a beneficial effect on hormones that store fat, such as insulin and leptin, in addition to increasing your calorie expenditure. Because it is regulated by both thyroid hormone and fat cells, leptin in particular is a major issue for thyroid patients. The likelihood of developing leptin resistance increases with the number of fat cells on your body and the degree of thyroid dysregulation. According to my personal experience, weight gain is the symptom that takes the longest to resolve and is among the most concerning for thyroid patients. One quick and simple method to speed up your weight reduction efforts and increase the effectiveness of almost any weight loss therapy is to exercise. Benefit number 4 is that exercise increases lean muscle mass and the general health of your muscle cells. This includes hormones, medications, supplements, and pretty much everything else you can think of. The main target of thyroid hormone function is your muscles, which control thyroid hormone signaling. Exercise increases lean muscle mass, which lowers muscular soreness, boosts metabolism, and aids in weight loss. Taking thyroid drugs, particularly those that contain T3, might have a catabolic effect on your muscle mass. Thus, it's also critical to improve the general condition of your muscles. In addition to helping with lifespan and aging, maintaining muscle mass is essential if you want to thrive as you age. Exercise can also help counteract the possible side effects of T3-containing drugs like cytomel and liothyronine. Benefit number 5 is that exercise elevates your mood. Consistent exercise helps you feel happier and makes your body more resistant to negative interactions. In other words, it doesn't force you to be happy, but it makes dealing with the stressors of everyday life much easier. This means that the more you exercise, the more likely it is that your mood stays regulated and balanced. It can also treat issues like brain fog, which again affects many thyroid patients. Either way, exercise can help. Number 6. More consistent and regular bowel movements. Unbelievably, exercise has been shown to help treat constipation, a condition that many thyroid patients experience. When thyroid hormone levels are low, your bowel's rhythmic motion slows down, which causes constipation. If you've ever experienced constipation, you know that this is not a feeling you want to endure. Exercise also increases lymphatic flow, which functions as a kind of massage for your intestines, encouraging the emptying of your bowels, which leads to more frequent bowel movements and a higher quality of life. Lastly, exercise aids in reducing inflammation. Inflammation of any kind is obviously undesirable, but it is especially detrimental to thyroid patients since it affects both the thyroid gland and T3 levels. In patients with Hashimoto's thyroiditis or Graves' disease, inflammation slows the conversion of T4 to T3, which lowers T3 levels in the body and encourages thyroid gland destruction. It is fairly obvious that exercise is good for thyroid patients, so the question is not whether or not you should exercise, but rather how you should exercise. There are several approaches to this. Exercise is a great treatment for hypothyroidism and autoimmune thyroid disease. The first relates to intensity. According to all known data, thyroid patients see the greatest improvement in thyroid function when they exercise at 70% of their maximal heart rate. According to the American Heart Association, exercise that is between 50 and 70% of your maximal heart rate is considered moderate, and exercise that is between 70 and 85% of your maximal heart rate is considered vigorous. I'll show you how to calculate this rate in a moment, so hold on while I do that. Even though you receive the majority of the thyroid's benefits at the 70% level, the truth is that you still receive some benefits if you go lower than that and some benefits if you go higher than that. However, there comes a point at which these benefits diminish and you may begin to harm your thyroid. And for conditioned athletes, that level seems to begin at about 90% of maximal heart rate. At this point, athletes began to see a decrease in both their free and total T3 levels. This is significant because if you're not a conditioned athlete, you're not listening. Since these athletes did not have thyroid issues at baseline, it is very likely that you will experience a decline in thyroid function at much lower levels of intensity. Higher levels of intensity, such as raising your heart rate above the 80 threshold, typically call for high-intensity interval training. Therefore, it is generally best to avoid high-intensity interval training as a thyroid patient. If you are just starting out, you can continue if you have been exercising for a long time and your body is already acclimated to high-intensity interval training. But if you are just starting out, you should avoid it. Then, your best bet is probably to aim for an intensity level of about 40 to 50% of your maximal heart rate. This is because, as I mentioned earlier, there is a significant risk of lowering T3 levels. So you want to avoid getting too close to that level. Thyroid patients are generally more fragile than the general population, so it's always better to err on the side of starting out low and glowing slowly. The worst thing you can do is watch this video, then go out and start exercising, which could actually damage your thyroid. Now, remember that I was going to teach you how to calculate your maximal heart rate. It's not as difficult as you would think, so let's get started. For example, to find 70% of your maximum heart rate, remove 220 from your age, then multiply that number by 0.7. For me, I'm 37 years old. You can easily figure out 50 or 70% of your maximal heart rate by lifting weights, so you know what the target is that you should be aiming for. It's only a matter of monitoring your heart rate from there. I know from personal experience that I can get that number. The next thing you want to consider when exercising with something like a low-cost wearable device is the type of exercise you're doing. Here, we have endurance, aerobic flexibility, mobility, and so forth. For a thyroid patient, the best combination of exercises would be to combine strength training and aerobic training. The strength training component is there for its benefits on muscle mass, bone health, longevity, and metabolism. And when I talk about strength training, I'm not talking about bodybuilding levels of intensity. What we're really talking about here is adding a bit more weight to your exercises than your own body weight. It may surprise you to learn that even 5 to 10 pounds more can make a big difference in your bone health and muscle mass. 1 to 2 days of continuous training per week, combined with 3 to 4 aerobic training sessions would be a good example of an exercise regimen for thyroid patients. The objective is to raise your heart rate to between 50 and 70%. And it doesn't really matter how you do it. Do yoga if you can raise your heart rate to between 50 and 70%. The last thing to keep in mind for thyroid patients who are trying to exercise is their thyroid symptoms. If walking, swimming, or anything else works for you, then do it. You can also bike. It doesn't really matter what you do as long as you get your body to that 50 to 70% range and stay there for 20 to 30 minutes. If you have a thyroid condition, you may experience symptoms like fatigue, depression, or muscle pain, all of which can make exercising much more difficult. The great thing about your body is that it is adaptive. So as long as you're doing something or putting stress on it, it will adapt and you'll become stronger. We're not running a sprint here, we're running a marathon. And the key is consistency. If that sounds like you and you're not sure where to start, you should start with walking or even just moving the big muscles of your body for 20 to 30 minutes every day. This will have a positive impact on cortisol and thyroid hormone. However, it's not the only thing you should do. If you want further assistance in controlling your thyroid symptoms, I suggest watching this video, which also covers the kinds of foods you should eat to aid your thyroid.